All right, happy Wednesday, Remote Bio. Today we are doing a lab, which I am working to convert for you into a virtual lab. Basically, this is a disease unit, and I can't let you do a disease unit without you getting a chance to diagnose some diseases. And one of the easiest ways, probably doctors' favorite ways to diagnose diseases, honestly, because it's not invasive. Patients are almost always willing to do it, and it's a test that's cheap. In fact, you can basically buy a pretty solid medical grade version of this test at your local pharmacy. I am talking about urinalysis. I am talking about basically having someone pee into a cup, getting a sample of their urine, and using what I like to call dipsticks to analyze that urine. You literally simply open a test tube, dip the dipstick, and then wait for the colors to change. And then once you've let it develop, put the cap back on. And it turns out that the jar that the dipsticks come in is your scale as far as reading what weird chemicals are in the urine. And by knowing which chemicals are in the urine, there's like umptillion different diseases you can diagnose. So I want you to have this experience. And so I'm basically working to make this possible. Your in-person classmates have done this, and I've taken pictures. And so let me show you what I've got for you. Basically, all this stuff is posted in your Google Classroom in separate files. Only one of them is a file that you're going to edit and type in. The others are going to be kind of read-only, and they'll be the things you need to actually complete your lab. Did that work? I think that worked. Yeah. Okay. So first of all, what you'll have is a file called Urinalysis Remote Readings, which you can see has got one of your classmates' group's results on it. Those are the dipsticks, but those don't mean anything to you, of course, without the jar thing. So I put my phone in panorama mode, which is why this looks weird. But this is basically the things you'd be holding the sticks up against to get the readings. Now, here's the deal. You only have to worry about 4 of these readings. The readings go across, they go horizontally, and you'll notice, and you can sort of see the little hand here. That means this is the way you hold the stick, and these are almost all normal readings. The readings you'll need are proteins, which are right here, pH, ketones, and glucose. Now, when you look at these, basically this means if there's no glucose in there, that's what color it'll be. If there's no ketones in there, that's what color it'll be. And if there's no proteins in there, that's what color it'll be. It's normal for urine to have none of these things. So any presence of these is a positive test, and you'll mark that down as a positive test. You don't have to worry about the numbers. Just if it matches anything but this stick, if it's out here somewhere, if the color matches out here somewhere, if I take this stick and I move it along and, for proteins, it's this color, that's bad. That's not what we want that patient to have. So that's a positive reading, right? The only exception to that is pH. This here is actually not a normal pH reading. This is an acidic pH reading. So if it's that color, that is an abnormal reading. Everything else, this is normal, this is bad. Okay, so that's your readings. The other things you'll need, because obviously you're not doctors, you don't know how to do this. Well, you're going to fake it pretty well. First of all, you've got patient histories. You're going to need these. There's 4 patients. They've got names and numbers. Of course, the numbers correspond with the sticks, right? This is patient 1, patient 2, patient 3, patient 4. Here's their names, their medical histories, and the things you need to know about what symptoms they're complaining about. That's info source number 2. Number 3 is here's how you interpret results. Each of these results, low pH, high pH, color, smell, ketonuria, proteinuria, and glycemic, that just means having ketones, having protein and having glucose in your urine, those are not diseases, those are symptoms, okay? This is what that could mean. So your job is going to be to take all of these sources, right? What they've got in their urine right here, what their patient history is, and what stuff in the urine might mean. This is where you actually do your stuff, right? You put your readings here. It's a positive, a negative, except in the case of pH, which is low or high. Give a preliminary diagnosis. That should be solid. You have enough information with these three sources to do that. And then here's where in number 7, what treatment do you recommend? This is where you kind of play fake doctor, right? Pretend you're a con artist, pretending to be a doctor, and you don't want to like hurt anybody or blow your cover, right? So fake it as best you can. Do that for all 4 samples, right? And we're good. Okay, that is the assignment. Please let me know if you have questions. If anything's confusing, I can help. All right, good luck, you guys.